Hi, welcome to another broadcast of JAMA Network Open Live. I'm Mike Berkowitz, electronic editor of JAMA and the JAMA Network. I'm filling in for Seth Truger this week.
And I'm Angel Desai. I'm the JAMA Fishbein Fellow.
And we have another great roster of articles for you this week. And we have an author of the first one, Dr. Andrea Volonte of the Department of Psychiatry at the University of Vermont, is joining us to talk about her article titled Association of Flavored Tobacco Use with Tobacco Initiation and Subsequent Use Among U.S. Youth and Adults between 2013 and 2015. So welcome. Thanks for joining us.
Thank you for having me.
Why don't you tell us and the viewers what it is that you set out to do? Tell us about your study.
Sure. So we had looked at cross-sectional data from the PATH study, the Population Assessment of Tobacco and Health, and saw that there was a relationship between first flavored tobacco use and current use. But that was in a cross-sectional study, and we had other data collected in subsequent waves of PATH that we were able to look at longitudinally the relationship between first using a flavored product and subsequently using that product. And what we found was that for people who initiated a new product in the past year, the majority of youth and young adult users started with a flavored product, and that was significantly higher than in adults, and that there were relationships between first using a flavored product and using a product a year later. So for example, menthol cigarettes, people who first used a menthol cigarette were more likely to be past 30-day, past 12-month users a year later across all age groups. And we saw this type of relationship across almost all of the products that we studied. So first use of flavored e-cigarettes, first use of flavored hookah, cigars, smokeless, etc., were associated with using a year later, and in some cases becoming an established user of those products.
So there's been a lot of public health concern about flavored tobacco products. We know about that. Is it fair to say that this is the first longitudinal view of the association between the use across these different age groups and subsequent tobacco product use?
Well, this is the first study to look at all tobacco products in the same data set. So we have really strong evidence on the relationship between menthol cigarette use and initiation and progression of use. But this is the first time we've been able to look at menthol cigarettes, flavored e-cigarettes, flavored cigars, flavored hookah, flavored smokeless, all in the same study.
Awesome.
I just wanted to take a step back and say I thought this was a really interesting study, but I wanted to ask you what got you interested actually in the topic. Was it, you mentioned that there was a preceding sort of limited cross-sectional study that came before, but was it just that the topic was timely, or was there sort of a hint that this association might exist?
So this is a topic I've been interested in for about 10 years, ever since the FDA gained regulatory authority over tobacco products. And so one of the first things that happened was that flavored cigarettes were banned in 2009 when the Family Smoking Prevention Tobacco Control Act was passed. But menthol cigarettes were exempted from that ban. So I've done a lot of research to look at how menthol cigarettes might impact public health, and then that extended to looking at how flavored products might impact public health. And particularly because I'm focused on youth and young adult tobacco use, this was a really interesting topic and something I've continued to pursue.
One of the things that I found really interesting, and you'll tell me whether I'm reading this correctly, from Table 3, it looks like the association between first tobacco product flavored among adults and subsequent any tobacco use was more robust, meaning it was evident in lots of different measures of subsequent tobacco use for the grown-ups compared to the kids who had first used a flavored product.
Yes, you're right.
And so that was really surprising to me, because you think of these as kids' products, things that are marketed towards adolescents and early young adults, but it seems like it's having more of a detectable effect, if I understand that correctly, from your data in people who are over age 25. And I was wondering if I read that correctly and what you thought.
So in both tables 2 and 3, table 2 is focused on young adults, table 3 is focused on adults over the age of 25. We see these very consistent significant relationships between first use of a flavored product and subsequent use across cigarettes, cigars, hookah, smokeless, e-cigarettes. And I think one of the reasons for that is that we have a larger sample size of young adults and adults in the study than we do youth. We have a smaller number of youth users. So that might be why we're seeing that statistically significant effect, though we do see that first flavored e-cigarette use is associated with subsequent use in youth, but it's just not a statistically significant effect, but the magnitude and the direction are similar.
Got it. And we have also published in the JAMA network a little bit about adding sweeteners to these products, particularly in the wrappers. And I was wondering whether there is I don't suspect your data can disentangle that, but whether there's a difference between a sweetener and a flavor and what effects those have.
So that's a great question and something that we're starting to explore in the field, as you mentioned. Certainly flavor has a number of dimensions and sweetness is certainly part of that. So we're thinking more as we learn more about the artificial sweeteners that are put in products. And if you've seen that there's sucralose and other sweeteners like that in cigar products, in smokeless products, we're starting to understand more about how flavor is constituted and thinking about how sweetness is a flavor constituent that we need to be concerned about when we're talking about regulatory action.
Was that one of the thoughts behind, the way that the question was asked, if I recall correctly, was that you first asked if there had been exposure to menthol and mint, and then subsequently if there were sort of more of these fruit-flavored items. Was that sort of the thought behind that, or how did that come about?
No, so the questions are asked fairly similarly across products. It's a little bit different for cigarettes because flavored cigarettes were banned in 2009. So the survey instrument does ask about ever flavored cigarette use, but then it asks specifically about menthol mint use. For all of the other products that we looked at, we grouped all of the flavors together. So menthol mint was lumped in with fruit or other flavors.
And forgive me, you may have this in the paper. We know, or at least I think I know from having read, that menthol is marketed to certain demographics in the country,
yes.
African Americans in particular, who may have taste receptors or other dispositions to want to become addicted to that flavor and the tobacco products that contain it. Are the effects you're describing here about flavors, are there any racial differences that one can, or demographic differences that one can read out?
Sure. So we did not look at that in this study, and there are other studies that look at the prevalence of flavored use in other products. But we do think that, flavors marketing is an important part of flavor. So the way that a product is packaged, what's the image on the package, how is the package colored, all of those contribute to the appeal of the product. So that we think, as you were asking about sweeteners, we also think that there are elements of marketing that play into this idea of flavors and appeal.
I wanted to actually bring up the figure. This was looking at the weighted proportions of new tobacco users at wave 2 who reported using a flavored product at first use. And I'm wondering if you could just talk a little bit about, because you look initially at any tobacco product and then you also sort of break this up and look at cigarettes and e-cigarettes and any cigar. And I wonder if you could just walk us through that a little bit.
I lost you during that question. Can you repeat the end?
Yeah, no problem. Just if you could walk us through that figure and some
Sure.
of the...
Yes. So this is a figure looking at 3 different age groups, the darkest bars being the youth, the middle gray bars being young adults, and the adults over the age of 25 in the white bars. And what we were looking at is in people who, between the 2 waves of data, between wave 1 and wave 2, ever started a new tobacco product, so whether they were new users of a product, we looked to see whether that new use of a product was flavored or not. And what you can see here is that there's an age gradient across many of these products where the youth and young adults are more likely to try a flavored product first compared to the adults. So this is just sort of supports work that we did previously where we see this tremendous age gradient in flavored use, where, again, youth and young adults are most likely to use flavored products, and we've seen that in menthol too. This was the first time we were able to look really prospectively at how people who start using a product in a 1-year period are using flavors or not.
So you mentioned the FDA banned flavors in cigarettes except for menthol. Do you think this is a step? What are they thinking? I know they're considering what to do with electronic cigarettes. What are the policy implications? There are obvious ones for public health, but that politics sometimes trumps public health. So just wondering what you think next steps are in research and in regulation, if any.
Sure. So FDA has actually issued a couple of advance notice of proposed rulemaking related to product standards that would ban menthol in combustible tobacco products, combustible cigarettes. And they have also identified flavors as a potential target for regulation in combustible products. More recently, we've seen information coming out from the administration looking at banning flavors in e-cigarettes. So I know all of these things are under consideration by FDA. They take a very science-based approach, so they request information in the dockets when they propose these rules, and ask scientists especially to contribute data to support their decision-making. I don't have a sense of where they're going to move. It would be great if we have a ban on flavored e-cigarettes, that we would also have a ban on menthol cigarettes and other flavored tobacco products, so that we don't have a situation, unintended consequences of people moving to really, really harmful products in the event of a ban on flavored e-cigarettes.
Seth, who's usually here, is fond of saying he's an optimist. I think I'm a little less of an optimist. I'm optimistic about what the FDA might do, but I'm not optimistic about the manufacturers of these products who mutate in order to provide products. I suspect that many of the flavored non-combustible and non-e-cigarette products are also manufactured by Altria or Philip Morris or whatever. They're going to move into these markets in order to maintain their market share. So you have a career and work ahead of you.
Yeah, unfortunately or fortunately, it keeps me engaged and really excited to continue this work. It's really important, and I hope, if it's not FDA, that this kind of work supports state and local policies to restrict flavored tobacco product sales to protect and reduce tobacco use in young people.
Well, we agree. We love the paper. Thank you so much for submitting it to JAMA Network Open, and thanks for taking the time to talk to us.
Thank you for having me.
Have a good afternoon. All right, so now we're going to move on to a next set of papers.
Yes.
What do you have next?
All right, so I have Gender Disparities in Invited Commentary Authorship in 2,459 medical journals. So this was a study that looked at trying to estimate the odds ratio of authorship or of authoring an invited commentary for women compared to men who had sort of similar expertise, similar background, similar sort of seniority as well. And they did this through a matched case control sort of method. They looked at all invited commentaries from, I believe, 2013 to 2017, and they used Scopus to find these commentaries. For the cases, they looked at essentially the corresponding author of the invited commentary, and then the controls in this situation were actually matched based on, as I mentioned, scientific expertise, and they used natural language processing to do that.
Right. So that's what's awesome. I just want to point out, because a lot of people will take like the top 5 journals and count up commentaries. This was done at scale across all of these index journals. Scopus is like PubMed, but it's kind of a proprietary index, and they used NLP, natural language processing, to gather all this information about these authors of invited commentaries. That's pretty unique.
Yeah, absolutely. So they ended up having a little more than 43,000 cases across all of the journals that they found. 26% of those invited commentaries were written by women. And they ultimately sort of concluded that the odds of being a woman and having an invited commentary were actually 21% lower for women compared to men, even though, when you looked at matching for expertise and sort of scientific seniority, etc., those were sort of the same. And we have figure 2, I believe, which actually shows this, sort of compares the odds of authoring based off of this.
Right. And so figure 2 was interesting to me because
Yeah.
if you look at it, and I think it's up on the screen, if it were a ship, it would be tipping over in the
Right.
water and throwing all of its passengers into the ocean, right?
Right.
Because all the odds ratios favor men in these invited commentaries. But if you look closely, the y-axis is percentile of active years. And if you look, it seems that younger authors of invited commentaries who are more junior in their careers, the tilt towards men is decreasing.
Yes.
So it seems like our industry of medical journal editing and publishing is progressing in the right direction, even though in these particular years, we're not quite there yet in terms of total equity. And there are clearly some specialties where men dominate, like cardiology, and other specialties where women dominate, which I believe is pediatrics, for example. So there's going to be greater or lesser chances. It's more damning in a specialty like pediatrics, but perhaps less so where there just aren't the female workforce as much. But in any event, like Seth, I was optimistic about this, even though the news for the moment isn't as good, and is good data to inform efforts to make journal editors want to include a more diverse authorship in their pages.
Absolutely. No, I was going to invoke Seth as well.
Okay.
We're thinking of him.
And let me just say, JAMA, and I believe JAMA Network, when we invited commentaries and editorials, encourage senior authors and senior faculty to bring along, we state an intent of increasing diversity in our pages and invite senior authors to bring along a co-author who matches that objective.
That's
so
fantastic.
Yeah, so we're trying to do what we can here too. What's next?
All right. So next we have simulation of health and economic benefits of extended observation of resolved anaphylaxis. So this was trying to characterize the cost effectiveness of short versus prolonged medical observation after an episode of anaphylaxis. And I believe the background behind this is that there is this phenomenon known as biphasic anaphylaxis, during which someone who's had the first episode of anaphylaxis can actually have a recurrence of the symptoms at some point later, even without being re-exposed to the initial sort of offending agent. And so they did both an economic evaluation, and they used sort of a computer simulation to randomize sort of individuals or patients to either 1 hour of medical observation versus 6 hours of medical observation. And they found that 6 hours of observation could be cost effective if the risk of biphasic anaphylaxis, I think they estimated at was at least 17%, or if hourly observation costs were low, so less than $46, or if we assume that the fatality from biphasic anaphylaxis is, I think they said 0.3%.
Right.
So all of these different assumptions into this model to try to estimate that. And I think ultimately they kind of concluded that, in a lot of situations, prolonged observation may not actually be cost effective.
Right. I mean, I think the clinical scenario is somebody comes into the ED, anaphylaxis, they seem to be stable. An hour later, a very small number of them go on to have bad events after they're discharged. So this is a totally modeled, simulated cost effectiveness study, and it didn't meet conventional standards of incremental cost effectiveness, which is $50,000 to $100,000, which incidentally was based on what Medicare was willing to pay for dialysis, like back in the 60s and 70s. Yeah. And there's all sorts of conversations about whether that's still a sufficient standard in 2019. But in any event, this answers this question in terms of the economic investment of developing OBS units or keeping these patients around.
We'll have to ask Seth if this is something he sees in the ED.
That'll be a follow-up.
Okay.
So, you want to do the next one?
Or either way.
So this one is the next article is Primary Care Clinician and Clinic Director Experiences of Professional Bias, Harassment, and Discrimination in an Underserved Agricultural Region of California. So this is really a qualitative study of clinicians, primary care clinicians, I think, and clinic directors who work in the San Joaquin Valley region of California. So this is an underserved region. It desperately needs primary care docs. And it took a handful, I'm not quite sure how they got this sample, and found that they're not having a great time of it, that there were frequent reports of either kind of professional bias or sex bias or sex harassment or discrimination amongst women, non-white, and sexual and gender minorities. And they don't get into the whys, but it sounds it's a little bit troubling because these areas absolutely need primary care workforce, and the workforce isn't feeling very welcome, either from coworkers or from patients themselves. Although I think the focus here was on kind of the other colleagues in that setting.
Yeah, I thought that was actually the really interesting part of this, because they found sort of in their qualitative assessment that some of the acts which were perceived to be discriminatory included things like threats to licensure and denial of hospital admitting privileges from their colleagues, on the part of their colleagues. And just as you said, this is an area that these are areas that really need primary care providers. And in some situations, the harassment reached levels where it actually prompted the providers to want to leave where they were practicing. So troubling, definitely.
Right. And this is out of UC Davis, I believe. So that's kind of, UC Davis is a wonderful medical center. And presumably, I read into this that it's some of their faculty or some of their satellite clinics that are the subject of this study. Yep. So something to keep in mind and also to be thinking about as we send our, hopefully our best people out into rural areas. But we all get educated.
Yes, definitely. Okay, so next we have stepped care, internet delivered versus face-to-face cognitive behavior therapy for pediatric obsessive-compulsive disorder. So this was actually a trial protocol for an RCT, or a randomized non-inferiority trial that's forthcoming. And they are aiming to look at whether internet-delivered CBT or cognitive behavioral therapy is non-inferior and also cost-effective compared with face-to-face CBT for a pediatric population that has obsessive-compulsive disorder. And I think, although I didn't see them go into the sort of more of a discussion on this, is that part of this is just coming from, I think there's been kind of a movement of sort of telemedicine in general, and particularly reaching, particularly for subspecialized care like this, being able to reach populations that may not otherwise be able to access this type of care. This may be one way to do that. And so this is going to be a multi-center RCT. There's 2 pediatric obsessive-compulsive disorder clinics, and this is in Sweden. I think that they have about 152 children between the ages of 7 to 17, and they're going to be looking at sort of baseline 3-month follow-up and 6-month follow-up, with the primary outcome looking at the total score on it's CY box, I believe, and I think this is a tool that's used to assess sort of severity of OCD symptoms.
Right, and JAMA just published a preliminary trial of fluoxetine in the use of OCD behaviors in autistic children, and used the same measure. Yeah. So this is a trial protocol. It's not the results. It states what the trial's ongoing, and the primary outcome, I think it's going to close to recruitment in about a year, May of 2020. Yep. So it's kind of a new area for JAMA Network Open, not entirely new. I don't think this is the first one. And hopefully I will be publishing the primary results also, which I think is probably a reason to publish the trial protocol. But it gives people a sense of what's going on, and it's a step above just registering it in a clinical trial registry.
Yes. Great.
So next up is the association of metabolically healthy overweight phenotype with abnormalities of glucose levels and blood pressure among Chinese adults. Did I skip a?
We skipped one.
Okay, which one did we skip?
We skipped the association of physical activity and fracture risk among postmenopausal women. I'm sorry.
Okay, why don't you take that?
Okay, sounds good. So this was looking to essentially observe the association of physical activity with fracture among postmenopausal women using data from the Women's Health Initiative prospective cohort study. They looked at over 77,000 postmenopausal women from the ages of 50 to 79 and identified sort of their self-reported physical activity as well as their self-reported sedentary time. They had a mean follow-up of, I believe, 14 years, and during that time, 33% of that population reported a first incident fracture. they found that and we have a figure here as well, which looks at the risk of total fracture classified by level of activity, but ultimately found that the total physical activity reported was inversely associated with risk of hip fracture, but there was a positive association with knee fracture, and there was also some sort of association with moderate activity specifically and wrist and forearm fracture. But that sedentary time was also positively associated with total fracture risk. And when they looked at these two sort of areas together, that actually having higher total activity mitigated some of the total fracture risk associated with sedentary behavior.
Right. So it kind of puts some nuance on what we think we know, which is that being more active is associated with a reduced hip fracture risk. The knee fracture and the wrist and forearm fracture were slightly interesting. It's easy to imagine active women falling,
yep.
right? Not because they're disabled, but because they're just more active and have more opportunities to take a spill and have a fracture, even if they're not osteoporotic.
Yeah.
And this is Women's Health Initiative, so it's a pretty robust sample set in the sense that there's just lots of data and lots of comparisons. That figure was interesting to me for no other reason that it could have been a table and it didn't need to be a bar graph. We call the ink to data ratio kind of pretty high because it's really hazard ratios with confidence intervals.
Right.
Right, which could have been like 3 lines in a table. But, okay.
All right, so let's move on
to the one that the one that I was premature on.
We're so excited about it.
Yeah, I was so excited, but now I have to find it.
Here we
so
go.
this is metabolically healthy overweight phenotype with abnormalities of glucose levels and blood pressure among Chinese adults. So this comes out of Shanghai, and this looks at 3,200 people who had an increase in BMI but normal glucose, lipid levels, and blood pressure levels. So that's what they're calling metabolically healthy overweight phenotype. And they followed them for a period of time longitudinally and found that a small percent of them went on to develop abnormalities, as you might expect, in these kind of cardiovascular risk factors. It was a high relative risk, an adjusted hazard ratio of 2.36 for elevated glucose and 1.73 for high BP. But I read this as about 4 and 7%, so kind of a low absolute risk.
Yeah.
And so that was kind of interesting to me. I guess I hadn't thought that much about metabolically healthy overweight people because the findings here are what I would think about that, which is that if they don't have it now, they're going to go on to have it.
Right.
And if you follow them even longer, probably more will develop that if they maintain high BMIs.
Yeah, absolutely.
So it's just, it's interesting. And, you know, the Asian populations have different metabolic, different distributions of fat. They have more visceral fat and different kind of metabolic phenotypes. So I'm kind of going to keep an eye on this because we're going to see more and more of this kind of study. And I guess the science is there, but I'm a little skeptical that there's metabolically healthy overweight.
Yeah, no, I actually wasn't aware of this term. I only recently heard about this term, I should say. So it will be interesting to see what comes out of it.
Yep.
Okay, so next we have cognitive development of infants exposed to the Zika virus in Puerto Rico. And so the investigators wanted to determine whether infants of mothers with at least one positive Zika test demonstrated any differences in cognitive score. And they looked at individuals between the age of 3 to 6 months and also from 9 to 12 months. This was a cross-sectional study looking at existing Zika cohorts in Puerto Rico. They had 65 participants. They were looking at, and I believe this is figure 1, looking at general cognitive and domain-specific scores to see if there were any significant differences. There were not, but except for receptive language, essentially, that domain did seem to be lower in infants that had been exposed to Zika in utero, I believe, or who had been tested, whose mothers had been tested prenatally. And they also found that receptive language was affected independently by the degree of exposure to Hurricane Maria as well. But, I'm actually not too sure what to make of these results overall.
Right. One of the issues, it's a vitally important work, but there's only 65 study participants. Yes. So if you're doing inferential statistics, it limits your ability to say there's a difference. Their difference that was in figure 1 of 5.5 on this scale, this Mullen scale, I'm not familiar enough with the scale to know if that's a lot or a little. And it was certainly, when I see p-values of 0.04, I think of it as being, just on the border of being something and not meaningful in and of itself just because of that p-value.
Right. And if we had more participants, maybe that,
I mean, it needs clinical context. I mean, so there was a big rush of things that we and other people published when this Zika syndrome or complex was first described, but then kind of the long-term follow-up of these kids is going to be really crucial. And not only kids who were clearly affected, but those who might have been exposed and not so clearly affected.
Yes.
So this was a single finding, and the work is good and should be ongoing, but I, with you, wasn't sure what it meant.
Yeah.
And I think we have one more?
Yes, we do.
Okay.
So this is a research letter, the association of length of time spent in the United States with opioid use among first-generation immigrants. So this was a cross-sectional study that used or gathered some data from the Medical Expenditure Panel Survey, which I don't know if you're familiar with, but I had not heard too much about it before.
Yeah, it's called MEPS, and it's a national survey that looks at all, where healthcare spending is going and kind of certain practices of care.
Well, great. That's good.
Yeah.
Because they ended up looking at sort of adult immigrants' use of prescription opioids, but very interestingly, they actually separated populations based on self-reported length of time spent in the United States to try to see if there were any changes over time. And I think the idea being whether or not there's any sort of association of cultural influence with opioid prescribing and being in the United States for certain periods of time. So they found that overall, almost 8% of adult immigrants use prescription or reported using prescription opioids, with most of those individuals having been prescribed as adults in the U.S. They found that non-immigrants were more likely to use prescription opioids compared to first-generation immigrants, but that as more time was spent in the U.S., the likelihood of prescription opioid use actually also increased. And we've got a figure here that demonstrates that as well. So very interesting, almost sort of anthropological things to think about here.
It puts me in the mind of how people who move to the U.S. and take on Western diets.
Yes, exactly.
End up getting Western diseases, and the messaging here echoes that, which is that people come here and develop opioid habits that seem to not have been a problem for them in their place of origin, which is really fascinating.
I think so too. Yeah. So I guess hopefully we'll kind of see more about this phenomenon or learn more about it, and other sort of things in this vein.
Right. So that's it for today. I think that's our run of papers. Check out everything we're publishing at JAMAnetworkopen.com. We release new articles every Wednesday and Friday mornings at 10 a.m. Listen to our podcasts wherever you listen to podcasts. Read the translations of our abstracts in Spanish and in simplified Chinese. Anything else to be thinking about?
Just, if you want, follow us on Facebook, Twitter, and now YouTube as well, yes.
And JAMA Network just launched a new Instagram account this week. So you can follow us on Instagram, and you'll find some JNO as well as other JAMA and JAMA Network journal content there.
Perfect. So we will see you next week.
We'll see you next week at the usual time. Thanks for joining us.
Thanks.